I just found when I was in medical school that the only rotations I really enjoyed were the ones where I was working with kids. And then when I had a chance in my 4th year to pick electives, it was all pediatrics. So I figured it out for myself. Rather than being in the hospital where I take care of kids who are admitted, I take care of kids when they just come into the clinic. So that'll be sick visits, that'll be sports physicals, annual physicals, well child checks for vaccines, things like that, and then anything in between. It's a lot of getting to know each other, so asking a lot of very personal questions, getting to know your history, who you live with, what goes on at home, what goes on at school, getting to know your medical history, what vaccines have you had, any hospitalizations, things like that. So it's a lot of going over older records and confirming things. And then it's just, conversations. I like making other people happy. And a lot of it is just the physicals, filling out forms, things like that, but knowing that I can meet those needs. And then seeing them when they are at their worst, when parents are at their most vulnerable because their child is sick. And they put their child in your care, and you can do even something small to help them, suction out a nose or give them a breathing treatment. And you can see that relief. And it feels good to be able to do that for families. I love trying new foods. I was very lucky actually growing up. My dad used to travel a lot, so he got my sister and I hooked on sushi and Thai food and all sorts of things when we were very young. So I love to go out to eat, and Cleveland has a lot of great restaurants.